name Musa. I've been invited today just as a service user, so someone that's gone from a journey from being admitted to the aftercare services of all the kind of different mental health services that were available to me. And the statement that I made was that when someone's asking, you know, people are making comments out there about the NHS being etc. this or that or that, I would turn around and say that the NHS did save my life. You know, eventually, you know, the NHS did give me what I needed, but potentially, you know, they gave me what I needed at that specific time. What's lacking potentially is the correct information being cascaded down to me as a young person to potentially maybe prevent that kind of stage that I got to. So more of a focus of being able to communicate directly with young people, and maybe not even those that are at risk, maybe just educating young people in general and explaining the consequences of certain behaviours or things that might happen as a result of what young people tend to do, I suppose, whether it's drugs, alcohol, etc., etc. For myself, it was there was a lack of accessibility from the resources that I use as a young person to acquire that kind of information. And what I mean by that is that although the internet's a massive thing, it's not as easy, or the information is not as attractive or services are not attractive enough to grab my attention. I think that's where the difficulty is communicating to people that are of a young age and that are in need of services. I briefly touched upon the involvement of an application, a mental health application called My Journey, which is an application kind of being developed by the Early Intervention for Psychosis Department in Surrey. So I had a bit of involvement in doing that as well. So I was just kind of A, telling my journey as it were, and B, explaining the My Journey application that we had out there as well. I think there's a very old school mentality on kind of mental health issues. Number one, there's not a lot of education in society out there, so doing everything possible to educate people out there so it's not that taboo subject anymore. But as well as that, potentially getting young people to communicate with young people, or if not, finding effective ways to communicate to young people, i.e. through social media, or whether it's festivals or kind of in a more up-to-date way of communicating with people, which is technology, and that's the kind of format that I think that the NHS in general should kind of move